Hello, hello, and welcome to another episode of Third Chances. My today guest is Roberta Wood. She's a retired nurse practitioner. She was a registered nurse for several years, and then she went back to school to study. And I am really excited to learn from her because she has very extensive experience in medical field. I we met on LinkedIn and realized that we work with the same technology, redox signaling molecules. And she mentioned that she has a very strong story to tell. But I would like to first go back to how did you get to the medical field? What inspired you to become nurse? And most importantly, welcome to my podcast, Roberta.
Thank you, Vera. I appreciate that.
Where are you calling from?
I live in Pennsylvania, and
Okay.
actually, this call is coming from Pennsylvania. I live up near the New York State border.
Mhm.
Um, I was accepted into nursing school years ago, right out of high school, but I didn't go because my father was ill. I got
Hmm.
married instead, and later on, I went back to nursing school. There was some programs that was offering help to people. Our local hospitals were hurting for nurses. And I went back and I first got my diploma in nursing from the Ogden Medical Center in Elmira, New York, which was like maybe 30 miles from my house.
Mhm.
I worked as an RN for almost 10 years before I decided I was going to go back to school. When I went back to school, I went to an NP program because in the years that I went to school, that wasn't a master's degree. I actually went to Community General Hospital's nurse practitioner program in Syracuse, New York.
Mhm.
At the time, I was working part time for a pharmaceutical company. I was working my way up to Syracuse. I'd go to class several days and then I'd work my way home.
So
So
what fascinated you as a child with the medical field? Did you always feel like you wanted to be a nurse or be helping people like that?
yes, I wanted to go out of high school, and I was accepted at a college to go to nursing school out of high school.
Yeah.
But like I said, my father was ill, and they were already putting my oldest sister through college, and there
Mm.
was no way that they could afford to help
Right.
me. Instead, I married my high school sweetheart. We're still married 51 years later.
Oh, that's nice. Congratulations. That's very
Thank
good.
you. Um, but I mean, life takes you on a different course, but it doesn't always stop your goals and your lifetime dreams.
Yes.
Um, so I did finish the community general program. I became certified as a family practice nurse practitioner. There were only three certifications when I graduated. There was adult, pediatrics, and family. So I took the family certification because it really encompassed all of them. And then I struggled because I couldn't find a family practice job.
Hmm.
So I went to work for a neurologist, actually. And I worked for her for 2 years before she decided she was going to make a change. And then they didn't have a position for me.
Okay.
So I had a restrictive covenant at the time. And so I couldn't really work as a nurse practitioner within 60 miles of where I had been.
Hmm.
So I took a position managing group homes and nurses for the developmentally delayed. I did that till my restrictive covenant was up. And then I actually went to work for a physician who was managing a nursing home that had like five different levels of care. I managed the nursing home itself and the dementia unit that was in there,
Mhm.
and worked for him as a nurse practitioner.
Those are
And while
hard.
I was working, yeah, it was a difficult time, but it was very rewarding. A lot of good families, people needing help. And he was a great mentor.
Hmm.
We frequently would have conversations because he would come once a month to the nursing home and round with me. And he was very good at teaching. I mean, I didn't have a problem calling him and asking questions. And if he said something, he was great at not being offended by me asking questions because back a long time ago, physicians really didn't like nurses asking really in-depth questions
Yeah.
if they weren't, you know, but he was excellent. And I jokingly said to him one day, I said, gee, you don't know good psychiatrists, do you? Because I had a patient who really needed some help.
Hmm.
And he laughed at me and he goes, you really don't know, do you? And I said, no, what? He goes, I'll send you Dr. Pavlard. Have you ever heard of her? And I said, yeah, I have heard of her. I said, I used to work in a different town. And I said, I heard she used to go to the hospital there and was awesome. Everybody loved her. And he said, okay, well, I'll see if we can't get her to come. He goes, and by the way, she's my wife.
I was thinking
And
that.
so I really,
That's funny. Yeah.
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 And it was because it was, I mean, I didn't realize who he was married to because
Mhm.
they really worked in two different towns.
Yeah.
He worked in Elmira, New York, and she actually worked in Corning, New York at the time. So I actually got to work with both of them. And the nursing home had been actively seeking a physician that could actually do all five levels of care. I wouldn't only take on the two because it was very time consuming the areas that I was working in.
What does it
And
mean, the
so,
5 levels of care? What would it require?
well, the nursing home had assisted living, they had assistive living, they had the nursing home end, they had a dementia unit, and
Hmm.
then they had a care that was like a hospice piece.
I see.
So they
Yeah.
had like five levels of care at that facility
Hmm.
in different buildings. It wasn't all in one building.
Right.
And that takes a lot of time and effort to
Yeah.
be able to accomplish. So after I worked there for about 5 years with this physician, they finally found a physician that wanted to come down and do all five levels of care. Well, he didn't want a nurse practitioner. He was not very kind, I didn't think.
Hmm.
He didn't like me asking questions. And I said, okay, well, that's fine. I'll go out and search for another position. Well, as my time was getting done, that I had given notice that I was going to leave, I got this phone call. And it was actually from this physician's wife, who was the psychiatrist.
Hmm.
And she said to me, she said, what are you doing? And I said, did you find a job? And I said, no, I haven't found one yet that I really connected with anybody. I said, I'd really like to find something that I, you know, could actually do. And she said, well, what do you think about coming and having lunch with me? And I said, okay, that's great.
Hmm.
Because I really enjoyed her. She was also a great teacher, a
It's
great
about
mentor.
people. Yeah. It's about people you work with too, not just, your job. Yeah.
Not just the patients. It's
Right.
it's knowing you have someone to go to if there's something you don't know how to handle.
Right.
Because let's face it, they have much more education than we do.
Hmm.
And sometimes you have to rely on them to help you find the right connections for the patient. So I went to lunch with her, and she was actually interviewing me, which I really didn't realize. She said to me, she said, I'm looking for a nurse practitioner. She said, I'd like to ask you if you'd come to work with me. And
Okay.
so I actually did. I worked for her for 7 years. It
Hmm.
was during that time that I was starting to have some significant health issues. I started to have them when I was at the nursing home, but I was kind of poo-pooing them, thinking, oh, it's going to go away, like
Yeah.
most people do.
Professional. Ask doctors about. Yeah.
Yeah, well, they didn't go away.
Mm.
She was very gracious, and I really enjoyed working with her tremendously. Worked for her for almost 7 years. And at that point, my health issues were really becoming very significant.
How long ago this
Um,
this is? How long ago? What time period are we talking about?
let's see, it would have been in the mid 90s.
Okay.
Um, and so I had started seeing a rheumatologist because of my health issues, and he
Hmm.
actually found two autoimmune disorders.
Wow.
One of them severely disfigures your joints as you go on, and I was continuing to have multiple joint issues.
Hmm.
The other one is an interstitial lung disorder. Um, and so I was having breathing issues. I was having other things go on at the time.
Hmm.
Like I had an arrhythmia for a while. They finally got that taken care of. But it was because the autoimmune was affecting other areas of my body. So when I was working for this psychiatrist. I was also visiting three nursing homes besides office patients.
Hmm.
And so the traveling back and forth between the buildings and stuff put a lot of wear and tear on my joints and my body.
Yeah.
And so I told her, I said, look, I know you're getting ready to retire, and I'm really not wanting a job where I have to do a lot of traveling. I said, I'm going to take a position, I said, in a call center and manage nurses again. I said, because I need something that's sedentary because of all my health issues.
Yeah.
And she understood. She was very good. So for about 5 years, I worked at a call center that did a lot of computer stuff for different areas of the hospital, like surgeries and that type of thing. I set up computer programs for them. I managed the nurses because they did call-ins and we had different things that we had to do.
Did
And
you
I did
have to
that for
learn
about
all
5 years.
that, or you already knew all
I
these?
did. Mhm. Oh yeah, they sent me away for, training. They sent me to Arizona almost every year because they had a specific system they were using.
Yeah.
And I, was very intrigued by some of the stuff that was there. But the health issues continued to get
Hmm.
worse.
Yeah.
I ended up with, right before I left there, I ended up with a big major back surgery.
Oh no.
My spine had actually fallen over itself and was kind of stuck on a bone spur. And the neurosurgeon that saw me said, whatever you do, don't fall in the next 2 weeks before I can get you in. He said, because you will paralyze yourself.
Yeah.
And I said, oh, that's not very encouraging. And he said, no, he said, you really do have a serious issue here.
Yeah.
So 2 weeks later, I had the back surgery. I had to be flat for 7 days afterwards. I had to go to rehab. And so they were, you know, issues that were really affecting even a sedentary job of sitting all the time. You know what I
Yeah.
mean?
Well, sitting is sometimes the worst for the back. Yeah.
It can be, yes.
Yeah.
And so since I was continuing to have more and more issues, and they were looking to downsize some of their stuff, I decided to go look for another position, and it was kind of a mutual thing.
Hmm.
And
But
so I went to
let
look
me
for another.
ask you, you having all these issues and they are progressing worse, yet you have your medical experience, plus you are surrounded by doctors that you can reach out to, like best specialists, I'm sure that you would be recommended. So there was no solution for you that would improve your condition? That were you looking to adjust your lifestyle? Did you try at that time anything alternative, or diet, exercise, all that stuff that is,
Yes, I
recommended?
actually had tried many, many things at that point. I had tried some heavy duty antioxidants because at the time antioxidants were taking off. I was doing physical therapy significantly. I was doing
Mhm.
massage therapy. I had tried acupuncture once. I had been taking a ton of vitamins,
Yeah.
and nothing seemed to be helping the issues or
Affect.
slowing them down.
Mhm.
They just continued to pile up and pile up. I ended up, I tried one other position for a short time and I told them about my health issues to start with so that they knew that if it didn't work out,
Yeah.
I was okay with them, you know. And it really didn't work out. I was only there for a very short time, because their presentation of what the job was and what it actually was not coinciding.
Hmm.
So I ended up taking a position as a nurse navigator in neurosurgery because I had experience in neurology and psychiatry, neurosurgery. They all use the same meds, except they use different modalities and different doses and things like
Mhm.
that. But I did more of an educational role with the patient. I'd get them set up for their surgeries. I'd order all of their labs. I'd monitor all their labs, make sure they were ready for surgery, and also educate them on what to expect, with the
Yeah.
surgeries and things. And it was towards the end of, it was about 3 years after, it was about 2018. And I was just walking down the hall and I fell.
Ouch.
And and I was having significant issues because I knew I was struggling to get my one leg to move very well. And one of the neurosurgeons was very kind. He offered to see me, and he repeated the MRI that I had, and we compared it to the one where I'd had the surgery. And he said, "You've got a couple of discs above that are not so good." He said, "Your joints are starting to fall apart." He said, "Let's try conservative treatment for a while and see what that does." It really wasn't going even a year later. And so I decided to retire in 2020. Um, and that was because I physically was in so much discomfort. And if I walked any distance, I was so short of breath, I would have to stop frequently and catch my breath or sit down and rest. I said I was really thinking that I was circling the drain at that point.
Yeah.
A friend of mine who had a PhD in nutrition and was a naturopath had reached out to me because she knew my daughter was a nurse. My daughter had gotten the long haul pandemic,
Hmm.
and she was very ill for a couple of years, and really wasn't getting any help out near where we were. I was very, very worried about her. She was struggling to get out of bed. She was uh, having all kinds of symptoms that they were just literally ignoring because they didn't know what to do with yet.
Yeah.
And her daughter had had the long haul pandemic, and she had something she wanted to recommend to me, and that was the redox signaling molecules.
Hmm.
And she said, "I know you're not going to do this right away." She said, "I know how much you do research." She said, "So let's talk on Monday." This was like a Friday. And I said, "Okay, let me do a little research." And I said, "We'll talk again on Monday." So I got on the computer and I started my research because I had heard of these when I went to school years ago,
You did.
but
Yeah.
and
Mhm.
I was told they were a waste product,
Yes,
that
that's was
they had no
believed. Yeah.
function
Yeah.
whatsoever.
Yeah.
And so I was really leery of what she was trying to tell me about.
Hmm.
So the research I got into was more of the more updated research, which when you're working full time, sometimes you don't have time to look into a lot of research unless it's for a specific patient.
Definitely. Yeah.
And so I got to looking into it, and she called me back on Monday and she said, "So what do you think?" And I said, "I see the research has changed significantly."
Right.
And she said, "Yeah." And I said, "I'm intrigued." I said, "I would really like to try this." I said, "But not just for me, for my daughter who was really struggling terrifically with
Yeah.
this pandemic thing." And so I went ahead and got some product and I pitched it to my daughter, so to speak, because, both of us being medical professionals were kind of leery because we both learned pretty much the similar stuff.
Yeah.
And she promised to give it 90 days. And I said, "Look, I'll take it with you. We'll compare notes."
Right.
And so she said, "That's a good idea." Well, and the problem was she really couldn't talk to me well. She actually had a paralyzed vocal cord,
Oh no.
and she had a bunch of different sequelae from this long haul pandemic. She had four autoimmunes before she got sick with the pandemic. And so she had been struggling just to work as well. But she tried to keep going, but after the pandemic, she couldn't get out of bed. She couldn't focus to balance her checkbook. She had
My God.
POTS, so every time she stood up, her blood pressure bottomed out and she would faint.
How old was your daughter
And she'd have
then? So,
she was in her early 40s,
wow. Yeah, that's affecting life pretty significantly.
really
Yeah.
affecting life.
Yeah.
Exactly. So her and I began the journey, and when we began it, the bottle said 2 ounces twice a day. So that's exactly what we took.
Hmm.
And about 90 days out, she said to me, "Mom, I don't think you need to keep getting this for me. I don't really think it's working." She texted me that because that's how we communicated because she couldn't talk to me.
Yeah.
And I said, "Well, I know you're tracking your migraines," because she was having an everyday migraine, or so the neurologist thought. And that's what they were treating. And they wanted her to track them so that they could see if the meds were working. And I said, "How many migraines have you had in the last 90 days?" Well, she pulled out her calendar and she said, "Wow, I've only had one in 90 days." I
Hmm.
said, so this is doing something. And she said, yeah, I guess it is. And so she had an
Isn't it
appointment.
interesting? You just remind me of how people are not used to track their progress, and they may feel that nothing changed for them, even though like significant changes happen, but you kind of forget what you used to have issue with when you no longer have it. And it's so
Right.
important. Yeah.
It's very important. And at this point, she was actually, her focus was better because she wasn't having the everyday migraine. She was still having the other issues of the voice problem, and occasionally the POTS, when she'd stand up too fast, she would have lightheadedness
Yeah.
and palpitations and stuff. And so we had made her an appointment at the University of Pittsburgh Medical Center. And she was going to go to their first long haulers clinic that they had for this pandemic.
Mhm.
So she went to the long haulers clinic and they did an endoscopy and they went down, they looked at this vocal cord and they said, well, there's nothing mechanically wrong with your vocal cord. But then they did an EMG on her vagus nerve. And that's the one that actually tells your vocal cord, sends the messages. You're supposed to work, you're supposed to rest, you're supposed to
Yeah.
work, you know. And they found that the vagus nerve was firing backwards. And they
Hmm.
told her the
Wow.
only thing that they knew that would help that would be a vagal nerve stimulator. But because she was now on Medicaid, because she hadn't worked in 3 years, they couldn't put it in because Medicaid wouldn't pay for it. She came home so discouraged.
Wow.
And
Yeah.
I said, honey, there's a reason for everything. I said, I know we have a medical board. Let's talk to them and see what they think about the redox. Because I said, you're making headway, but maybe you're not on enough.
Yeah.
I said, I know what the bottle says, but let's talk to somebody. So she was agreeable to that. So I went over to her house and we made a call, and up through my upline, we got a hold of some of the guys and they asked us what we were taking, what vitamins. They asked us the whole 10 yards. And I had her on a lot of things trying to get this vocal cord to work, but it had
Yeah.
made a significant change. And so they said that they really felt she wasn't on enough of the redox. They had some newer studies coming out, but they weren't out yet. And they made a suggestion that she work her way up to a very significant dose. And they were
Mhm.
talking 16 ounces a day.
Yeah.
And so I said to her, I said, what have you got to lose? I said, you can't get the vagal nerve stimulator. We know it helped your migraines. And I said to the guys, how much longer do you think it's going to take her, even at the higher dose, to see a significant change in this vagus nerve? And they said, well, it's probably going to be at least another 5 to 6 months on this higher dose.
Because it depends on everything else what she was dealing with, her body was dealing with. There was not just one
Right,
singular issue. Yeah.
exactly. She had 4 autoimmunes, and these will go to your body's greatest need
Yeah.
first. And so she decided she was going to go up on the dose. We agreed we would make sure she had it because she wasn't working, so she couldn't afford much.
Yeah.
My husband and I decided we were going to go all in on this.
Well, you want to help your
And
kid.
we
I mean, her quality of life was really very
was not
poor.
very good.
Yeah.
Right. And so we went in on this and she increased the dose. And in the meantime, I ended up tearing a tendon and having some foot surgery. And my friend said to me, why don't you come down and recoup for a little bit? Come put your foot up. I'll wait on you for a while. And my husband said, I'm not going. I'm going to stay home. I have work, so I'm going to stay home. And I said, okay, I'm going to go down, let her wait on me for a while. I'm at my friend's house and my phone rings, and I'm thinking it's my grandchildren calling because my daughter never called me for
Hmm.
almost 3 years because she couldn't talk to me. She
Right.
always texted me.
Yeah.
So I answered the phone, said hello, and I'm thinking it's the grandkids. And she goes, hi, Mom. I understood everything she said. I said, oh my goodness, Becky, when did it come back? And she said, I waited 5 days. I was afraid it was going to go away again.
Oh my
She
God.
actually got her voice back.
That's
And
incredible.
it was incredible. And I mean, she has continued to make strides and she's continued to do better. And I'm the same way because when they encouraged her to go up on her dose, I went up on my dose.
I was going to
because
ask
I
you
was,
because you started with her. So what was your experience in the first 3 months? Did you
well,
see
in the
a,
first 3 months, I was noticing that my pain level, because I'd had surgery in that time frame too, was significantly better, and that I had backed off to just Tylenol at the time. And I
Mhm.
had been on 3 pain meds before the surgery, or,
Oh,
with the surgery and before,
yeah.
because I was on 2 before and then I was on 3 after the surgery. But I had been able to back down off of everything but Tylenol for this
Mhm.
discomfort I was having. And so I was noticing that my pain was better everywhere. It wasn't just the toe that I had had surgery on, it was most of my joints. I had also noticed that my one hand that was actually bending up, and I wasn't able to flatten out my fingers, I could now flatten it out.
Mhm.
And so that was telling me that those joints were actually becoming more flexible again as well, which they had not been for a long time, because I used that hand to write with, and I that hand was literally stuck kind of like this.
Ouch. Yeah.
And it's not anymore. I can open that hand. So I continued on the higher dose as well. And I went to the doctors and I had some lab work. I see a rheumatologist and they draw your sed rate. And I said, I want to know what my sed rate is on this. I said, it's got to have improved on these molecules. I said, because I can feel the flexibility coming back.
Mhm.
And she said, okay, let's do your sed rate. My sed rate had dropped 19 points from the previous year
Can you
when I had
explain to
bumped that
people
dose.
what does it monitor in the body?
It monitors inflammation.
Right.
The sed rate, or the ESR, they call it when they label it, measures how quickly your blood cells drop to the bottom of a tube in an hour. And the quicker they drop, the higher the number and the more inflammation you have in your body.
Yeah.
And mine was at 39 and it dropped to 20.
That's significant. Yeah. That was
And
after how
so
long?
that was a year, because I saw the rheumatologist yearly.
Mhm.
And so that had dropped. I had also gone to my, when she drew that lab, she drew another lab, and I had gone to my primary as my, I was seeing her every 4 months. So I was seeing her 3 times a year. I had gone to see her because she had also ordered some labs. And we realized that my kidney functions, which had been a stage 3 kidney disease on everything that I had been taking and the
Hmm.
inflammation and everything, I had been a stage 3 kidney disease. And I was, if it got any worse, I was looking at dialysis. Okay. They actually were back in the normal range. And my primary
That's
was
stunning.
literally flabbergasted.
Yeah.
And she said to me again, what are you doing? And I said, remember that pamphlet I gave you on the
Yeah.
redox molecules? And she said, wow. And this is the only thing you've changed. I said, yeah, it's the only thing I've changed. So we began, I explained to her I had dropped off all the pain meds but the Tylenol, and that I wasn't having any pain, and that I wanted to see what else I really didn't need, because at the time I was on 14 meds.
That's I was gonna mention because that makes effect too, because every medication has some toxicity level that creates demand on the liver and kidneys. So
That's exactly right. You're
what is the
exactly right.
difference when you upping these molecules? Are you not putting yourself in danger with those as well?
I don't believe there's any difficulty with those molecules. We lose 1% a year
Yeah.
in our bodies, and I'm not young. Uh, I shouldn't say that, but I mean, I retired at 65 and I've been retired 4 years. So I'm 69 years old and I'm not getting any younger, and neither are my organs. And they can only tolerate so much toxins. And every
Yeah.
med you take is a chemical. Your body has to detoxify it to get rid of it. And so we had started weaning things off. I currently am only on 5 meds. I still take some vitamins, ones that we have talked about and my provider approves. And I also take the Redox, and I did not go down on my dose. I'm still up at that higher dose right now.
Yeah.
And I continue to do better. I have my stamina has improved. My breathing has improved. Um, I don't get short of breath, even just a short walk anymore. I can actually walk almost a mile and not get short of breath, which
Yeah,
I could
that's
not do for years. It's been years since I could do that.
yeah.
So that was a significant change. And
Can
the
I
joint pain, like I said, is gone.
go ahead? Go ahead. Sorry.
So I went to Utah because I really wanted to see where these redox molecules were made. And I wanted to do a little bit more research while I was out there. And we actually walked from our hotel 6 blocks to a restaurant, had dinner, and walked 6 blocks back. And I wasn't short of breath, and I wasn't the last one in the building.
I
And
know
that to
these
me
milestones
proved,
are huge for us. Yeah.
you have to have something that's telling you that this is worth what you're doing, that this
Yeah.
is accomplishing something. And this has actually accomplished more than all the meds I was on. I think the more meds they were giving me to try and help, the worse my symptoms got, because I think some of that was caused by the meds.
Yeah,
Not all of it, but
they each have significant side effects, unfortunately, and may create even new problems in the body, right?
exactly, exactly.
I would like to
So
just stop you for a second because I think it's a good time to kind of give a disclaimer because we were talking about a lot of issues that you were dealing with, and I just want to make sure that any technology, products, or modalities we are mentioning here are not intended or implied to be substitute for professional medical advice, diagnosis, or treatment of any disease or illness. We are talking about redox signaling molecules, and they are not designed to treat, cure, heal, prevent, or diagnose any disease or medical condition. They are not a medication. They simply empower the body to heal itself by increasing cellular efficiency, functions, and communication. I just want to make sure that we make it clear that we don't claim that this technology will heal you, cure you, or prevent anything. It simply empowers the body to do the work on its own. And we were designed to be brilliant self-healing machine. But with everything that you throw at it, as you did, so much physical work, stress, toxins, all the effects from your work and from, life happens and everything, the way you eat, the way you exercise, if you could even because you are exhausted from work, all that creates a lot of damage to our body. And yet we still expect that the body will function 100% of the time, which is really hard. So this is just a tool to make your body work on optimal levels again and figure out what needs to be figured out on its own.
I call them God molecules because they truly are. But
Yeah.
I have got the proof in writing. I mean, my lab work shows improvement, even without all the medications I was taking. My stamina and my ability to be able to enjoy life again has changed significantly.
Yeah.
And I'm glad to be able to enjoy my retirement now.
And let me tell you that you were humble enough to mention your age, and you look fantastic. If
Thank you.
anybody is watching the YouTube video of our conversation, you don't look nearly 70 to me. So it's the fun effect that you can have with this because it's the cellular health inside out and outside in. And the more we use it on our face and on our skin, it also allows body to replenish the cells and the cellular turnover to become faster. So it heals you faster and it slows down the aging process, which is fantastic formula for life, I think.
I think it's a wonderful product. And there's no toxicity with meds because these molecules are already inside of you.
Yeah.
So if it did not interfere with any of my meds or cause any adverse effects for me. And to me, that is a blessing because many meds, and I know very few, and I can't even name one, that has side effects. I mean, when we
Okay.
go to the doctor, they tell you, oh, well, this could cause this, this, and this, and they're
Yeah.
correct because you don't know how your body's going to react to them, where the redox molecules are absolutely non-toxic.
Yeah. And especially even people believe that the something that they buy over the counter is safe because it's approved for sale and you can take it. But Dr. Silverman often mentions if you have a really strong headache, you cannot take 50 Tylenols. It will kill you. It's
It
just,
will.
it's the toxicity is there, and there's the LD number, the little dose that every pharmaceutical have to report before they can even test it on humans. And it's people don't realize it. And certain medication is not designed to be taken long term. You can only take it temporary. People don't pay attention to these warnings, and it creates havoc in the body, unfortunately.
People need, I agree, people need to be willing to make a change. You
Yeah.
know, a lot of us get stuck in our ways and we don't want to make a change. But if you really want to, you can actually help your body heal itself
And safely, yeah. But
safely.
I realized that you partner with the ASIA company to start sharing this with others. How long ago was that decision made? Did you start selling
Actually, it's
right
been
away?
about 2.5, yeah, about 2.5 years
Okay.
since I joined the company, and have been studying it ever since. You know, a lot of people will ask me, well, what do you think about it with this disorder or that disorder? And I will go and research it for them, but I try to give them the pros and the cons and say, you know, your consistency is what's going to really affect your outcome. If you decide you're going to do this, you can't just do it today or for a week or for a month and say, oh, it didn't do anything.
Yeah.
Your body took a long time to get to this point, and it's going to take a while for it to get back to stability.
And you have seen the example of it on your own daughter, because if you didn't reach out and ask questions, she would just drop it after 3 months and decide that it didn't do anything for her. Yeah.
Right. And but being objective and knowing what questions to ask, you know, I think that really helped her realize that, oh, it was doing something.
Yeah.
And I think it's anyone could do this. All you have to do is say to someone, gee, you look better to me. You look like you've dropped some weight, or how are you feeling? You know, just asking simple everyday questions of your friends and family that are trying this and encouraging them to keep going because they know that it's not going to work overnight.
Yeah.
But by having these standards that we can actually look at our blood work and see what it's doing, you know, and things like that, it really can be helpful.
Yeah. I think the great idea is, and I heard it from somebody before, and I never thought of it when I have somebody who is looking into the Redux protocol and considering if they want to give it a try. I meant to remind them, why don't you go and take the information test and see, and add this to your regimen, don't change anything else, but then 3 months later go and have that test retake again. And because we have the
Yes,
study
because
that
it's
show,
validation.
yeah, because not
Yeah, it
everything we can
validates that
feel.
it's doing something.
Yeah.
Right. You may not be seeing or recognizing, like my daughter, that it was doing anything.
Yeah.
But when you have a lab test, like, and I'll give you another example, uh, you know, with people who have blood sugar issues, my husband's one of them. And he didn't want to try this at first,
Hmm.
but he finally decided to try it. And when you start seeing your A1C come down, because your body's actually using this to help get the sugar into the cells instead of it staying in the bloodstream. And he got his numbers back. That was real proof for him
Yeah, and I bet
that it
he
was
didn't
working.
feel it physically. It only shows
Nope,
on the blood work. Yeah, that's
that's correct.
yeah, that I think that for me is the hardest part to sometimes get across, because people people are so used to take a pill and something goes away. And this is doing, your body is doing much deeper cellular repair that is on foundational level. And it's not gonna, some people have, I was the lucky one that I felt incredible improvements within first 7 days. But not everybody is so lucky. It's about 10-15% of people can feel something immediately. But the longer you stay consistent, the more things have time to start working. And like you properly said, like when you see it on a blood work, that's not something that you feel. I had my cholesterol affected positively. I didn't feel when my cholesterol was high, even though I eat healthy and exercise and do everything right. My cholesterol started rising, and I think it was stress related. But I also didn't feel when it suddenly dropped 60 points when I started taking it. And it's, for people to say, I don't feel anything, you may not for a while, but it's still working. And we have studies that prove that 100% of people on double-blind placebo studies were affected, as opposed to 0% of those that were on just regular saline.
I agree with you. Many times that's how people years ago used to not realize that they had high blood pressure because they couldn't feel it,
Right.
or they didn't recognize that that's what was causing their issues, that they just thought they were getting older, and that's what happened to old people.
Yeah.
But your body, these symptoms, your body's telling you something. And we have 75 trillion cells in our bodies. You're not going to heal that many cells overnight. It doesn't matter whether it's a medication or whether it's these redox molecules. It's going to take time for them to get into the cells, help the cells clean out the toxins that are stuck in there, and then help that cell get back to functioning or replace it, because your body can replace cells.
Yeah. And you remind me of a good point, because you were a medical professional, you were among doctors, you were experiencing issues that were progressively getting worse, and whatever you tried the traditional way wasn't working really much. And
Mhm.
at some point, and I wish people realize that before it become big issue, we have to take responsibility for our own health. Because to your point, I have met doctors with myself and with my husband who basically throw hands in the air and say, well, what do you expect? That's normal for your age. So they contribute to that feeling that, at certain age, you are supposed to feel this and this, and it's going to only go down the road from there. And I refuse to sign to that philosophy. I have been looking relentlessly to find something that would keep me fit and optimal as possible, because I don't want to age and end up on a wheelchair or somewhere in a nursing home for sure. I want to do everything in my power to, because my body is my body, and no doctor, I mean, however well they want to help you, and they could be wonderful, and I don't mean to trash doctors. There are such a great doctors out there that really save lives, but the prevention and the chronic stuff is really just throw a pill at it or throw a surgery at it. And I have been victim of that as well. And it's not doing much long term, because it will progressively get worse. And I have been at point in younger age than you, when I was told, well, this is just your new normal and you have to adjust your life around your symptoms, which wasn't the answer I was looking for. And this is 2009 for me. I wasn't even 50, and I had 3 back surgeries, unfortunately. So
Well,
it's,
and I think that,
I can very relate.
unless we do question the norms and learn some of the new technologies that are out there,
Yeah,
we are doing our bodies a disservice,
yeah,
because you have to stay up. Things change. I mean, years ago, what did we have to treat with? An aspirin and penicillin. When I retired years ago, there was over 3,500 drugs. And so that was all changes in technology and knowledge in the medical field. So, you can't just poo-poo that this is not what it says it is, because it can be proven. And in fact, that's why the FDA lets them put this on the back of the bottle, that there are certified redox molecules in these bottles. And every fourth batch actually goes to an independent lab to prove that. And so I think unless you have an open mind and are willing to make a change so that you can get as much of your enjoyment out of life and your vitality back, you're doing your body a disservice.
And it's in our control as soon as we make the decision that we are in charge of our health, not our doctor. We need the doctors in our life, but we cannot 100% rely on their recommendations and helps, because we need to do our part as well. As if it requires changing of a lifestyle, changing of your diet, because you can't expect to be sitting on a couch, stuffing yourself with burgers and fries and drink Coke and expect to be healthy forever. It's not doing much in your body that is positive, unfortunately. And I think this is
very right.
Fantastic time, because we are experiencing much more of the censorship around alternative methods coming down, because there is more flashlight being shined on the practices and kind of propaganda that was surrounded all the science and medications, and only one narrative was approved and the other was banned. And that's not what science is. Science became like buzzword for anybody who disagreed with you. It was like, oh, you are anti-science. No, science always progresses, as you can confirm as a medical professional. It is never staying the same. And the way we improve science is we start questioning things, and we allow doctors with different opinion to get at the table and come up with the best solutions that will actually improve the science that we have available now. So it's been wonderful time now to see this.
Yeah, I love seeing the changes, and I enjoy sharing this with people. Although the skepticism will always be out there, you have to make the decision for yourself.
Yeah.
It is a personal decision, just like when the doctor offers you something for an issue, you have a choice, as you said, to choose to do it or to not do it.
Yeah, and I think, it's most of the people wait until that alarm goes out really loud and clear. And I always try to encourage people, it is much easier to prevent the fire than to putting out the big already progressing fire. It's much easier to not even get to that point. But yeah, I think most of us believe, oh, I'm healthy, I don't need anything. And then boom, and it's a different story next day. For you, it was progressing for a while, right? But it's yes. For some people, it can hit suddenly. And I heard once Dr. Maureen, who is a researcher, veterinarian, who said, if you knew you're gonna get a heart attack on Monday, would you do anything differently today? And it's a question, because this is not outrageous claim. It happens. It happens out of blue. I lost my husband that believed was pretty healthy, and it was out of the blue. We didn't expect it. My husband told me about a few weeks before he collapsed in front of me at home that he didn't remember when was the last time he felt so good. We both were kind of comfortable. We were doing everything right. We were eating healthy. That was my business. He exercised. We had a trainer. We both had issues with our backs, but other than that, I don't have any other issue. He had several, which I kind of overlooked for some reason, and I don't know why. So he was on some medications, but he was doing pretty good. And then boom, and stuff that we never expected came out of blue, and 68 days later he was gone, and that completely shattered me. And it's for me, I unfortunately didn't know about this soon enough. I learned about this several months after he was gone. And my first reaction when I tested it on my body and see what it does, I looked up the sky and I was asking, why now? But you know, we all have reasons why we align with a company or with purpose like this. And for you as a nurse, and you have seen throughout your career a lot of suffering, the nurses,
Yes.
nursing homes and pain and, you know, suffering in the hospitals. People go to hospital when they are really in danger of life or they are in really bad shape. Medical field cannot always help 100%. So
Right. If you wait too long, it's very difficult for them to help you with much of anything. And
yeah,
it's sad that people wait until things are at the extreme before they reach out and say, oh, there's something wrong. Because you're right. Many people will say, oh, I'm still doing pretty good. I don't need anything.
yeah,
When in reality, you're looking at them and you might see some stuff and you say, well, what about this? And, oh, I've had that for years. That doesn't mean it's doesn't need addressed.
yeah,
There's things that, like your sugars, like we said, are silent. Like your blood pressure was silent and you didn't
yeah,
even know it was going up. Those things can potentially cause significant issues
yeah,
that can highly affect your life and even take your life.
yeah.
So it's important to still reach out to people and say, there is other things. If you don't like medicine, there are alternatives.
What does it mean to you as a nurse practitioner, retired now, when you compare the way and tools you had available to help people then, and when you compare to what you're working with now, and seeing the effects of it, how does it make you feel? Is there a comparison that you can make?
I really wish I had known about this sooner because I always did check things like people's vitamin levels,
Mm-hmm.
because we were finding, even when I worked in psychiatry, that many times vitamin deficiencies were causing the issues. And if you think about it, we need a balance of everything in our bodies
Mm-hmm.
in order for the cells to work properly. And many times I would find people that had malabsorption syndromes or were not absorbing the things that they were taking. And so their body was declining quicker.
Yeah.
And so we're tuning into that more now than we used to. Years ago, if the doctor told you to take a multivitamin, you were lucky.
Mm-hmm.
Most of us didn't even know what each vitamin was used for. I think that people are looking at a more varied way of treating their bodies. They're looking for a better outcome than what they were getting on just meds, because meds
Right.
treat symptoms. It doesn't really fix the problem.
Right.
So you're looking for things that are going to help fix the problem. And some of it, like osteoporosis, is because we're lacking vitamins that we don't have.
Yeah. And we don't get it
Your
from
bones.
food, no matter how healthy you eat, because the quality of the food changed in terms of nutrition and all the minerals and vitamins that we are supposed to get from food. So that's very
Correct.
different
And if you don't
story.
absorb it because you have something else going on,
Yeah.
that's another issue in and of itself. Plus, the processed foods that we are getting today in the stores is really adding to issues of these deficiencies.
Yeah. You would think it's done on purpose, don't you? It's one big
Food for thought.
enclave of economy. Yeah, it's really it's I'm so happy that the attention is being paid to all of this lately, and more prominent specialists are coming out and talk about the importance of cellular health and what everything can be done to improve your health on a cellular level, because that affects absolutely everything. It doesn't
It
matter
does.
what.
We're made up of cells.
Yeah,
Our whole body is nothing but
yeah,
cells.
yeah,
Our tissues are made of cells and our organs are made of cells. So if you don't get down to the cellular level, you're not going to help fix the problem.
yeah. We are both blessed that we discovered this, and I'm so excited to have to meet you and see that you still didn't put your foot down. You keep on serving people and you keep up helping people. Once nurse, always nurse.
Yes,
And
you're right. And
yeah.
I appreciate it. And thank you so much, Vera. It's been great chatting with you.
Well, thank you. And I just want to have a last question. How is your daughter doing today?
She actually is back to work. She still has her voice. She still has a few issues that they're still working on, but she's got her life back. She's
Yeah.
not in bed all day and she can't, do activities of daily living. She actually can. And so it's great to see her back being independent again.
Oh, I'm so happy to hear that. That's just, you don't risk much to take charge of your life. You will get to point where you really need to be taking care of that one Ferrari that we are, because we cannot keep replacing parts forever. It's
That's true.
only it's only one body we have for life, and we deserve to pay attention to it. So this was such a pleasure, Roberta. Thank you so much. I really appreciate your story, and if anybody wants to reach to Roberta, I will post all the links in the show notes of this episode. So feel free to reach out to her or reach out to me, and I will introduce you. We met each other on LinkedIn, but she's on other social media as well. And this was really a pleasure, and thank you so much for your time.
Thank you, Vera. You have a great day.